Good morning, everyone. It's Shani here with a quick little message about checking your blood pressure. I am preparing to go work out, but on most mornings, I try to make it my intention to check my blood pressure. Okay, I'm a person who comes from parents and family members who have a stroke history, so it is important for me to know my numbers in particular. I'm approaching 40 years old, and so it's just responsible to check my blood pressure every day, and I want to encourage you to do the same thing. Okay, let me tell you why. High blood pressure is often regarded as a silent killer, particularly for those of us who are members of racially and ethnically diverse communities. Okay, our numbers in terms of heart disease, hypertension, cardiovascular disease, stroke, cancer, diabetes, you name it, obesity, our numbers are very high in comparison to members of the white community, right? So we have to be very vigilant in particular about knowing our numbers. So if you are pregnant, trying to get pregnant, have already been diagnosed with hypertension, um, have a family health history of hypertension, know you probably don't eat the best, okay, aren't really attentive to your nutrition and diet and wellness goals, you might want to start checking your blood pressure. Buy a quick little machine off Amazon. This costs $20. Okay, a fill-in costs $20. So think about it. What are you gonna do? You're gonna, pay more attention to other things, or you're gonna pay attention to your health. Now, make it a habit. Don't beat yourself up if you forget some days. Okay, we're all, works in progress. But make sure you are checking your blood pressure, especially if you are already on some type of medication, because you need to know your numbers. And by tracking your blood pressure when you wake up in the morning, you're better able to communicate with your doctors about your health needs and also your wellness goals. Because the goal is, if you can get off of your blood pressure medicine, you don't want to be on it for the rest of your life. But sometimes we need it. I know many people, regardless of their size or their lifestyle, who just have conditions where their blood pressure is naturally going to be elevated. I have a family health history of it. I have to stay on top of my blood pressure because my blood pressure can also elevate. Sometimes I'm in a stressful environment, stress goes on, my blood pressure can increase. So I really work with my internal medicine doctor to keep my numbers together and make sure that I'm on the right treatment plan for my blood pressure. So when I get up in the morning, take care of my needs. But before I start moving too much in my home, I take out my little $20 blood pressure machine from Amazon. This is not even by a particular brand. It reads electronic blood pressure monitor. It came in one day, and I checked my blood pressure. This morning, my reading was 123 over 84. My heart rate was 72. I have downloaded a mobile app in my phone where I just type those numbers in, and I keep a log of my blood pressure. I may check it once a day or once in the morning, and if I remember, check it later in the afternoon. I probably pretty much don't check it too much in the evening, but make it a habit of yours to check your blood pressure and to really pay attention to your blood pressure, especially as we are moving through this pandemic. We are all stressed out. Everybody has gained weight. We're doing, our best during this pandemic. And so stress causes us to, feel a sense of anxiety, and all of that stuff just plays into our wellness, and it really works against our goals. So again, I cannot emphasize it enough. The holidays are coming up. Many cardiovascular infractions do occur around the holidays, like Thanksgiving, Christmas, New Year's. So people have heart attacks and strokes. They really do increase during the holidays. So make sure you are taking care of yourself, and just remembering that you matter. Make it your intention to check your blood pressure and to be proactive about your health, and just know your numbers, because what we don't know can actually hurt us or harm us, and so we want to be vigilant about it. So that's my message. Have a wonderful day. Now I'm off to cycling. Take care. Bye.